next one? DLC. Then TRTC. Then what else? TLC and TWBC is same. Okay. This is total white blood cell count and total glucose cell count same. Next. CBC. Okay, CT, BP, what else we finished? Flow cytometry, then PBS, right? Peripheral blood smears. Okay, very good. So a quick overview of all lab tests. Listen. So in hematology, we have three major branches. If you remember my first lecture. So hematology has three major branches. What are those? Basic hematology, then immunohematology, or it is also called as transfusion medicine. Very good. Or it is also called as blood banking. Right? Next one is bleeding disorders. Bleeding disorders. Okay, very good. So now tell me, what are the basic hematological tests we have? What test you will perform in basic hematology? Yeah. So CBC is a core code for all these things. DLC, TWBC, TRBC. What else you will perform here? ESR, PCV. Do you know what is the difference between PCV and ESR? You don't know. What is PCV? Packed cell volume. What is the significance of packed cell volume? Oh, you don't know. What is the significance of packed cell volume? Why we are doing PCV? Any idea? And you finished 3 semesters in MLT. What is the significance of packed cell volume? You don't know. Listen, it is the plasma to red blood cell ratio. How much plasma we have and how much red blood cells we have. Plasma to red blood cell ratio is called as packed cell volume. Is it clear? Plasma to red blood cell ratio is called as packed cell volume. What is the significance of PCV? Any idea? Listen, Miss Amanda, right? No, what is her name? Juliet, sorry. Julita. Anyway, listen now. If a person has 8 liters of blood, assume 7 liters of blood. Ideally, when we say blood is a combination of both plasma and red blood cells. So what I was trying to say was, in 7 liters of blood, at least 75% should be red blood cells. Got it? In 7 liters of blood, I am writing here, if this is 100% bar, in this at least 75% must be packed red blood cells, PC, okay? Packed red blood cells. If you compress all the cells, there should be around 75%. This is a normal condition. In normal condition, 75% of your plasma should be compensated with red blood cells. Okay? Now let us see in a hypothetical situation. Our Julita drank a lot of water. She took a lot of water, leading to her plasma expansion. Her plasma became 110%. Her plasma became 110%. Now she has more plasma, but her cells are 75 only. Now whether Julita is anemic or normal in this scenario. In this scenario, where the plasma is 110%, okay, is Julita anemic or normal? Normal. She is not normal. Okay? As per her plasma expansion, her red blood cells should compensate. Red blood cells should be around 77%. If they are not accompanying that gap, she will be anemic again. again. This is a very important phenomenon. We always think about normal RBC count, normal WBC count. If these things are normal, you are non-anemic. We are assuming. We thought that if your red blood cell count, WBC count is normal, you are not anemic. But let us perform your PCV now. Is your cells appropriate to your plasma volume? Your normal, so-called normal red blood cell count is accompanying with your PCV results or not. If your PCV coming high, that indicates still you are anemic. You don't have sufficient red blood cells to manage your plasma ratio. Got it? That is the idea behind PCV. PCV always checks whether your packed cells are compensating with your leftover plasma or not. There is some normal value of PCV. So PCV gives a important anemia status actually, anemia indicator. Okay, whether the patient has anemia or not, irrespective of red blood cell everything, irrespective of individual cell count, just to check the PCV. If PCV is normal, overall she might be normal. Even though her red blood, see sometimes this happens, when you are doing this lab, this machine test, your red blood cell count will be around 3.8, but we are saying 4 million. 4 million is normal value, but you have 3.5, but you are not showing any anemic symptoms. Maybe your plasma volume also reduced. Maybe you are recently got menses where you got huge hemorrhage. Your plasma together you lost the blood. So it looks like a normal red blood cell, decreased cell count. But if you see your PCV will become normal. Because overall plasma also reduced. So overall you might be normal. So PCV plays a vital role to check the anemic status. Got it? So please remember, if you forgot PCV, it is one of the important tests that will be done under this one. Okay. Then, apart from this, we are also checking a special white blood cell that is called eosinophil. We need to check the eosinophil count. Okay. Eosinophil count will determine the allergic status of the body. Forgot all other white blood cells, neutrophil, basophil, forgot others. Eosinophil has its own significance, and the counting of eosinophils is called as, any idea? Absolute eosinophil count. Write down. There is a special test called absolute eosinophil count. So what might be the normal count of eosinophils? You know the answer. You can get from DLC. What is the normal eosinophil count? Yes? Never let monkey eat banana. 2 to 4. That's it. Right? 2 to 4. So 2 to 4% of your overall white blood cell count should be the absolute eosinophil count. Okay? Then we have one more test that is called as a platelet count. A part of CBC. So all these things comes under CBC. Platelet count. Okay? For platelet count we have a special reagent. Each month's time we have one more L-Ridge eyepiece. So we will use a modified eyepiece and we will check the platelet count. Ideally you can check platelets in Yuba chamber, in RBC sphere. In RBC sphere you can count platelets. We have a separate calculation for platelet count also in Yuba chamber method. Yeah. So that is the platelet count. Next one. Another important test in basic hematology will be CT-BT. Okay, CT-BT also normal test, but if you go more specific to understand the bleeding condition, hemorrhagic status in the body, then you will do special testing bleeding disorders. That we will see later. Then another one I need to discuss, that is indices. Do you know what is indices means? Do you remember what is indices? What is indices? Do you remember? Now, let me give you a few scenarios of anemia. Actually, I already discussed these things with you earlier. is my first question. Okay. What factors leads to anemia in the body? First and foremost, we know all CBC values. All CBC values must be normal. If those values drop, definitely there might be anemia. Reduced RBC count, reduced WBC count, reduced neutrophil count, reduced all platelet count, everything. That is one criteria to know the anemia. What is the second criteria to know? Very good. Iron deficiency. She came, very depth actually. How iron deficiency contributes to anemia? How? Very good. HB. Reduced HB. So HB also plays a vital role. If your HB is less, you are anemic. So why HB is less? Maybe you are iron deficient. Maybe you are folic acid deficient. Maybe you are vitamin B12 deficient. To understand these things, you should know what is erythropoiesis, cofactors. Erythropoietin from the kidney, suprarenal gland, then vitamin B12 synthesis from liver, where vitamin B12 has an interesting pathway where it is generated by a gut microbe, and that gut microbe requires one more factor called intensive factor of Casey. You remember, anyway, there is a bacteria. The bacteria will make a factor. In the presence of this factor, vitamin B12 will be absorbed into the circulation, and that will be utilized for RBC production. Anyway, next one. What other factors contribute to anemia? Very good. RBC shape abnormalities or morphological abnormalities leads to anemia. Can you give one example? Very good, very good. Sickle cell anemia. We have multiple cells actually. Target cell, sickle cell, acanthocyte, bulb cell, vacuolated cells. Multiple things are there. Anyway, very good. So shape abnormality of RBC lead to anemia. Very good. Any other condition? Malnutrition. Simply. Malnutrition. So this is a very broadest term. Obviously, when you are not eating properly, you can't synthesize the required proteins, leading to anemia. Very good. Any other conditions? Any other? I need 20 conditions. Now explore. 20 conditions of anemia. Yes. Any other conditions of anemia? Yes. Very good. Excellent. Pregnancy. Very good. Pregnancy. Since you get pregnancy, can you elaborate? Menses. Menses also one reason. Yeah. Menses. So pregnancy. How pregnancy causes this anemia? Any reason? Any idea? One simple reason. You already know. Yeah, very good. Melissa was very smart. Everyone appreciates Melissa first. See, in pregnancy what happens was, the mother's plasma will increase. Not red blood cells. Her plasma increased. Why her plasma increased? Now she is circulating to the baby also. So now it became, baby cannot make its own blood as of, in the first to second trimester. So after second trimester, the mother compensating baby circulation. So mother's blood volume will increase. Mother's blood volume increase, but red blood cells remain same. Because there is a normal capacity of red blood cell production by the mother. Her bone marrow cannot crank up more red blood cells, more than her capacity. Obviously leads to a anemic status. So in pregnancy, one of the best tests will be PCV. Actually need not to do. We know that pregnant women will have anemia. So that is why we will give these supplementations, these things to the mother, because she is in constant anemic status. So we are giving these supplementations to increase her red blood cell count. We are maintaining her RBC count. Very good. So pregnancy is one factor leading to anemia. Menses, you said, menses, we need to break this progesterone and estrogen to be present. The next. Very good. Hemorrhage. It can be any hemorrhage, right? Bleeding. Hemorrhage means bleeding. Yeah. So bleeding. Surgery. Oh, very good. Oh, surgery. Yeah, correct. That is a related bleeding complication. Very good. Okay. Post-surgical. Then infection. Very good. Give example. Then I will appreciate. Malaria. Very good. Malaria or dengue. So in this, malaria will target red blood cells, whereas dengue will target the platelets. This virus will target platelets. So very good. That leads to anemia. Any other reasons? You are giving good reasons, but I also need some reasons that I need to justify my indices. Yeah, that's why I was waiting for that answer. PCV, we discussed here. PCV review, volume variations. Very good. Next, any other reasons of anemia?
Trauma.
Trauma. Trauma is again a fancy term for bleeding. Yeah, if you say here that is a trauma, also a fancy term for bleeding. Next.
Liver damage can lead to the decrease of the erythropoietin.
Oh, very good. Very smart approach. Liver issues. Okay, very good. Liver damage, because liver is a major, protein factory in the body. So obviously, albumin, all plasma proteins, connected. Very good. Next, liver damage leads to anemia. Okay. Next, alcohol. That's an indirect pathway here also. OH will damage liver. Yes. Next, maybe if you are smart enough, you can try. It's a part of GIT only. Now give me example. Malabsorption, not malnutrition. Right? Malabsorption. I hope you understood, right?
Yes.
Maybe some issue with digestion issues leading to anemia. Very good. Malabsorption. Yeah, very good. Next. Any other factors leading to anemia?
Abnormalities in the bone marrow.
Very good again. Everyone appreciate again. Very good. Bone marrow dysfunction or bone marrow issues, disorders. Can you give examples of bone marrow disorders? Complete absence of bone marrow activity is called as a type of anemia. Do you know what is that? Aplastic anemia. Very good. Aplastic anemia. Very good. Very good. Again, aplastic anemia. Any other reasons? See, anemia is very interesting topic. Very, very interesting. That is why every doctor, the first thing the doctor will order will be CBC test. Whatever condition is, first if we see your CBC, we will understand. If you are anemic, definitely one of these factors are relating for your disease. Any infection or anything. So CBC is the first thing. If you went, many of you might went to dispensary. The doctor first she will, order a CBC. First do CBC, then she will do the next, diagnosis. So CBC plays a vital role. So hematology is the center of our, epicenter of all lab medicine. So you should be proud of hematology lab. I want to boost my subject anyway. Next, any other reasons? RIA. Now RIA will give 10 more reasons. Yes, RIA. Now FESSEL also will give along with RIA. They are a team now. Yes. FESSEL just thinking, why is it? What will be this? Others? Yes, Regina. Nutritional deficiency.
The lack of education.
Lack of
Education.
appetite.
Education. Sir, answer for number in English and कुछ तो लिखना पड़ेगा.
Lack of education. That's a universal problem. Lack of awareness. Okay, like to say, then I can add here, since she said lack of education, socio-economic status awareness, financial, socio-economic, it's a combination of both social practices and financial matters. Then awareness, as she said, you are really giving 20 points. Next, lack of awareness or education are next. Oh, very good. You already wrote Miss malnutrition. Yeah, next. Yes. Any other reasons? Yes, Miss Mimi, you should tell now. Cancers. Genetic disorders like cancers. Very good. So cancers. Can you tell me 2 types of blood cancers? There are broadly 2 types, if you remember. You know? Yes, leukemia. Leukemia are of 2 types. Do you know what are those? See, acute leukemia and chronic leukemia. Write down this point, very interesting. Acute leukemia are of 2 types further. Acute means you know, right? Something that is very spontaneous, aggressive, short time period. Fast, acute. Chronic, long time. Something that is very slow, progressive, right? So, this acute leukemia is 2 types further. Acute lymphoid leukemia, that means here the cancer is to the lymphocytes, is called as acute lymphoid leukemia. If the cancer is to the myeloid series, myeloid cells, for that you should understand hemopoiesis again. So broadly these red blood cells will take 2 pathways, myeloid series and lymphoid series. Lymphoid will give lymphocytes, myeloid will give all other blood cells. So if the cancer is to the myeloid series, that is called as acute myeloid leukemia. Acute myeloid leukemia. Similarly, even in chronic leukemia we have 2 types. Chronic lymphoid leukemia, chronic myeloid leukemia. These are the broad categories of leukemias. Very good. Clear? These are the types of blood cancers, by the way. Next, any other reasons of anemia? Genetic factors, someone said, obviously genetic factors. Can you hear examples of genetic factors? Genetic diseases. Genetic blood diseases. And apart from sickle cell anemia. Apart from sickle cell, apart from cancers. Yeah. Yes, Miss Mimi. Everyone clap for Mimi. Very good. Thalassemia. Very good. Thalassemia. Very good. Next, any other reasons? Tell the answer. Yes, Melissa. Yes, Mr. Ekal. Everyone clap for you. Very good. Hemophilia. Hemophilia. Very good. See, multiple reasons. Next, any other reasons? So I will give you now the next reasons. Do you know the difference between shape and size?
Yes, sir.
Immediately you got the answer. See, who said now? Very everyone shape and size. Now Vidichal will further explore.
Sir, macrocytic and microcytic.
Again, clap for this. Microcytic anemia and macrocytic anemia. Very good. Now shape abnormalities. She became now, these patakas. Pataka means mini bombs that you will travel in Diwali. Anyone. Shape abnormalities, sickle, then spirocyte. The red blood cell will become ball rather than biconcave. That is called spirocyte, sickle, any other shapes, right? Very good. Next one, since you said it, HB abnormalities. Can you tell me who will tell? Decreasing HB and increasing HB. What are those called as? Increasing HB is called as what? will answer. Appreciation first, right? Yes, Julita, shout your answer now. Hypochromic and hyperchromic. Excellent, Julita. Yeah. Hypochromic anemia and hyperchromic anemia. Very good. Excellent. Excellent. Now listen. Anemia can be even more interesting now. See, sometimes the cell will become large, okay, but hemoglobin will be normal. Is it possible?
Yes.
Cell was large, but hemoglobin, what is the ideal hemoglobin amount? Around 14 to 15 grams. Since the cell increased, if the hemoglobin is 17, that is not an anemic status now. Increased cell, increased HB. So it's a normal condition. That is why these things are further classified into hypochromic microcytic anemia, normocytic anemia, macrocytic normochromic anemia. So they are further classified depending on their size, HB content and shape. Shape, okay, keep it as said. Got it right? Very good. Now, my next challenge. Is it a necessary thing to count HB in a single red blood cell? Can we be able to measure HB in a single red blood cell? Is it possible? I am not telling about a 1 ml of blood or 1 drop of blood. I am telling a single red blood cell. Is it possible to count that? It's not possible, right? You think? Yes, then tell me the answer. Then no. Is it possible to measure a single red blood cell volume? Is it possible?
Yes.
How? Again no. Yeah. We must measure. We have some significance because we need to know whether it's a macrocytic anemia, microcytic anemia, hypochromic or hyperchromic or whatever the other condition. We must assess these types of anemia also. And for that, imagine, do we have any micro, nano, cute little weighing machine to weigh the weight of a single red blood cell, the HB of a single red blood cell? It's not possible, right? But we have indirect approaches to measure those. And that is where today's my lecture is all about. That is indices. For this indices, I discussed these many things. Yeah. Now listen. For indices, we need a group of lab tests. If we have these lab test data, we can measure the indices. What lab test we need? Right on. The materials required for indices is, I'm telling you a very normalized, examples. It's not ideal materials, but anyway. Indices requires the following data. It requires RBC count data. You need RBC count data of the patient. You need the PCV data of the patient. PCV count. Then third one, like our Tapelo, anyway, now I don't want to disturb you. PCV, next after PCV you also need a HB count. You need RBC count, PCV count and HB count for indices. Let me see, anything else? Yeah, that's it. Yes.
Can MC also be covered? MC.
What?
Can MCV be covered?
Can MCV be? Don't worry, I will discuss that. As Julita is one of the most smartest but quiet person in your class. She knows everything. See? Very good, Julita. Yeah. The first and foremost thing, I just want to see the definitions. That's why I was searching here and there. I need a proper definition. That's where it is discussed. PCMC proper definition. Yeah. Right on. First one, MCV. What is the full form of MCV? Can you tell me? Mean corpuscular volume. Very good. Mean corpuscular volume. Do you know what is the meaning of average? Tell me what is the meaning of average? In a sum of, in a set of data, the average, the most repeated value can be the average, right? So, or simply the average height of you. If you take, it will be around 5.2. Some will be, rarely someone will be more than 5.2, someone will be shorter. But average there will be 5.2, for example, right? So here, MCV will see the mean corpuscular volume. What is the average volume of the red blood cell in a given set of population? Average volume of the red blood cell. Average volume of red blood cell. I am not telling single red blood cell here, keep in mind. I am telling the average volume of in a population of red blood cells. Got my point? Average. Very good. This will be measured. The unit of measurement of MCV is femtoliters. Write down, very important. Small f, by the way, FL. Femtoliters. MCV is measured in femtoliters. Okay? Now write down the formula of MCV. Write down the formula of MCV. As I said earlier, one second. Write down the formula. For MCV calculation, you need the data of PCV in 1 ml of blood, PCV in 1 ml of blood, divided by 1 liter of blood, 1000 ml of blood, divided by RBC count in millions. RBC count in millions into IS here it is into 10. Yeah, into 10. So to measure your MCV, all you need was your PCV value and your RBC value into 10. You will get your MCV data. You take your PCV data and your RBC data of the same patient, you will get the MCV data. The normal range of MCV right now, normal range of MCV is around 92. Actually, let me check here. Yeah, 78 to MCV normal value. 78 to 92 femtoliters. Okay, 78 to 92 femtoliters. If MCV is more, that will be macrocytic anemia. If MCV is less, that will be microcytic anemia. This is the significance of MCV. MCV will measure the average volume of red blood cells in a set of population. The formula is very simple. You can by heart like this. MCV has PCV. PCV by RBC count is your MCV value. Normal count is around 78 to 92 femtoliters. Is it clear? Next one. Write down MCH. This is very interesting. MCH. Next one. MCH. Mean corpuscular hemoglobin. It was very interesting that it measures HB in a single red blood cell. It measures HB in single red blood cell. In a single red blood cell. How it is calculated? Let us see. Mean corpuscular hemoglobin. Now, the measurement unit of MCH is picograms. PG. The unit of measurement for HB is MCH is picograms. Now write down the formula of MCH. Formula of MCH. Very simple. H stands for hemoglobin. Hemoglobin for RBC count in million into 10, I guess, into 10 will be your MCH value. Okay, normal MCH value write down. Actually, textbook to textbook these values are differing. Anyway, write down. As per scheduling book, the normal range is around 27 to 32 picograms. So, yeah. So, very simple to recall. MCV, PCV. PCV by RBC count, whereas MCH, HB by RBC count. Clear? MCH, HB by RBC count in MCV, PCV by RBC count. Next one, mean corpuscular hemoglobin concentration. The third indices is MCHC. MCHC. Oh, this MCHC is trying to understand. In MCHC, it is also trying to measure HB in single RBC, but in relation with its volume. I said previously, right? If red blood cell volume increased, whether appropriate HB present or not. If appropriate HB present, again normal. Got it? That status can be measured by MCHC, mean corpuscular hemoglobin concentration. The definition is it will measure HB in a single red blood cell in relation with its volume. Here it's not binding volume. Here it will mind the RBC volume also. That means if MCV is macrocytic but your MCHC came normal, then you are normal. If your MCV value is both, MCV value is 100, indicating macrocytic anemia. But your MCHC came normal. Why it came normal? Appropriate HB might be present in the large cell. It will come normal only if the appropriate HB present to the volume of the cell. So write down the formula of MCHC first of all. MCHC formula write down. HB in grams per 100 ml of blood by P. Okay, HB by PCV here. Simple game. HB by PCV into 10 into 100. Yes. So here see, since we are dealing with the volume of the cell, volume will be determined by the plasma volume by the PCV and the HB value. HB divided by PCV into 100. I given a very simplified calculation here. Just to see in the textbook, you will understand how they came to this conclusion. Okay. Normal value write down. What is normal value of MCHC is, as per scheduling, it is 30 to 38%. 30 to 38%. 30 to 38% is the MCHC values. Yeah. MCHC. Then last and final, a simple concept that is called as color index. Color index was very interesting. Fourth and final, CI, color index. This color index will see the ratio between percentage of hemoglobin with percentage of red blood cell. It will check the ratio between percentage of HB versus percentage of red blood cell count. If red blood cell count is 5 million, how much HB is present in the ratio of HB in that population? Okay, that is called color index. Color index normal value, write down 0.8 to 1.2. Color index normal value is 0.8 to 1.2. And the formula, it is a two-step formula actually. HB percentage by RBC percentage, bus. Formula is HB percentage by RBC percentage into 100. That's it. You will get your ratio data. into 100. That will be your next one. So yeah, this is yes, Julika has some doubt. Yes. Color index. In color index, what we are doing was the patient maybe patient has normal HB. When we calculated the HB hemoglobin of the patient, it came normal value. But his red blood cell count decreased. But we are saying that what is the purpose of red blood cell? To carry oxygen. Oxygen is carried by the HB. If you only see the RBC count, we will think that the patient is anemic. But see the HB is normal. Maybe patient was not anemic. So that is why we need to check the ratio, how much HB present for how much red blood cell. This ratio also important. Whether the HB was compensated with the cell count or not. If not, what it indicates means the RBC was destroying somewhere. Since RBC destroyed, till we are getting normal HB, but RBCs are destroying by something else. Maybe some drugs, some diet, some pathogen, something problem is there. There is some disbalance between HB to RBC ratio. Previously what we thought, if RBC is normal, definitely HB will be inside the RBC. RBC count K normal means HB should be normal. That is a normal condition, right? We thought that RBC present inside the red blood cell. If number of folds are less, definitely number of software will be less, HB will be less. But here the ratio disbalance indicates RBC destroyed but HB is present. That indicates RBC destruction, some hemolysis is happening. Anyway, you just keep this here. It's a very interesting thing, the pathways. Just keep in mind it's a ratio between HB and RBC. Percentage of HB, percentage of red blood cell. That is called color index. Okay? Yeah. So this is all about the indices of this one. Okay? Red blood cell indices. These four test together called as red blood cell indices. MCV, MCH, MCHCl, color index. So a quick recap of indices again. So what is the significance of MCV? What is the definition of MCV? Tell me, students. Yeah. It is the average volume of the red blood cell. Average volume in a group of red blood cells is called as mean corpuscular volume. What is the formula for this? PCV by red blood cell count into 10 is the this one. What is the measuring unit for MCV? Hematoliters. Hematoliters, FL, right? So what does it indicate? If MCV is more, what type of anemia? Macrocytic. If MCV is less, volume is less. Microcytic anemia. That we understood. The next one was how much HB present in a single red blood cell. How much HB present in a single red blood cell. This is called as mean corpuscular hemoglobin, MCH. What is the measuring unit of MCH? Picograms. What is the formula? HB by RBC count. HB by RBC count into 10. Now, tell me, students, what is the normal count, by the way? MCH. 32, 27 to 32 picograms. Very good. If it is greater than 32, what does it indicate? If MCH is greater than 32, what anemia is it? Hyperchromic anemia. If it is less than 27, hypochromic anemia. Very good. Then, what is the concept of MCHC? What is the definition of MCHC? What does it measure in relation to the volume. Hemoglobin in relation to the volume of the red blood cell, single red blood cell. Mean corpuscular hemoglobin concentration. Here how we will measure? HB by PCV. PCV will measure the volume. So HB by PCV is the MCHC. Then last and final was hemoglobin to red blood cell count percentage. HB percentage to red cell count percentage. It is called as color index. What is the normal color index? 0.8 to 1.2 percentage is the color index. Clear? Yeah. Now, so this is all about basic hematology. In this semester was moreover focusing on basic hematology compared to the other branches of hematology. So if you know all these concepts by now, then your semester was succeeded actually. Not on your marks but on academic status. Right? Yeah. Then coming to the immunohematology. I just discussed it profiles, but I will cover these things also. Yeah. Next was immunohematology. What lab test we will perform in immunohematology? Very good, Bidichan. ABO grouping. Apart from ABO grouping. Last time I asked this question, I think Bidichan was absent. Most of your classmates failed to answer this. What is the difference between grouping and typing, Bidichan?
Grouping, sir, A and B, and typing is
very good. Typing is always about positive or negative. RH factor status is called typing. Whereas ABO will discuss about the A status of A and B on the group. The group available on the red blood cell. If none of the A or B are not available, what group is that? O group. Very good. Okay. Now Hawa will answer. Hawa, tell me this group, Miss Hawa. A, B, D. I got result like this. What group is this, Miss Hawa?
O positive.
Everyone appreciate Hawa. Well done, no problem. Now, Mr. Simon. Mr. Simon, who is that? Britain Got Talent anchor. The judge. Simon Powell, I guess his name. Mr. Simon will discuss this one. What group is this, Mr. Simon? A counts of group K. TP or Human International. What type of blood group is this? Mimi, are you Simon or are you Simon's blood relative? AB positive. Now Simon will answer one more. What is this group? When I am asking, Simon checking down rather than on board. Yes. What group is this? Something is cooking up there. Now Miss Mariam will answer. Mariam, right? What is this group, Miss Mariam? AB positive. A positive. Now Miss Chantal will answer. What group is this, Chantal? A negative. Are you sure? Now Mr. Tapalo, our saint got woken up. He was enlightened now. Now he's in different dimension. He's more mature than us. He's more wiser than us. Now Tapalo will answer. What group is this, Tapalo? O negative. No, you should not tell like this. So you should give a more formal answer. Now it's a new dimension, based on my wiseness. This is nothing nil. The universe is made up of static, so it's more negative. Yeah. Should be more wise, Mr. Tapalo. Anyway. What lab test you will do if Juliet has some inflammation?
Yes, sir.
Yes, sir. You have very proud classmates now. You are on safe side, Juliet. Now, Miss Mimi will answer. Tapalo what? Parasitic infection. What lab test you will do? What hematology lab test you will do to check Tapalo? You suspected Tapalo has parasitic infection. What lab test you will perform? Especially that is a tinea solium, a digestive infection, tapeworm infection. Now, what lab test you will perform in this to confirm whether Tapalo has parasitic infection or not? What? We suspected he has a parasitic infection. What lab test you will perform to confirm whether he has parasitic infection or not?
PBS.
PBS.
Yes.
PBS you are trying to say, but that is not available in PBS. That's not a PBS parasite. Okay, PBS is one answer. Anyone? TLC. DLC. What you will check in DLC? What lab data you will try to check? Huh? Very good. Everyone, please clap for Muskan and Julita and Muskan. Very good. You will perform absolute eosinophil count to check whether our capillary has parasitic infection or not within the hematology lab. Very good. Now Ria will answer, even though she came right now. If Chantal suddenly started coughing and she was at took collapse, she started complaining that she has some brain migraines, pain, okay, severe body itching, and when she is coughing, she is also coughing out the throat. What lab test you will do and what is the possible problem in her body? Coughing with some cough, throat in the cough. Throat means surfaxal throat. You know that's surf. What hematological problem she might facing in this scenario? I will give her clinical history. Clinical history is she need to take a regular blood transfusions. She might have hemophilia, so not hemophilic. She might be thalassemia. She need regular blood transfusions, and she had a before coming to our lab, she has a blood transfusion. Now she got a complication. What might happen to the Chantal now?
So maybe she's having any allergic reaction or allergic problem. So we
Anaphylactic shock, anaphylaxis might happen, allergic happen. Even more complicated. Now I given a clinical history also. I said she might, she had a previous transfusion before coming to the lab. Now what might be the situation? Coughing out the throat, migraines. Eventually, she will collapse. Before collapsing, we started seeing some red patches on her skin. If you want, I will give more data on Chantal. We captured her urine. Urine also started becoming very brownish to red, indicating some hemolysis started in the body. What's going on in her body now? I given the answer actually, unfortunately. Accidentally. This is a classical symptom of DIC, disseminated intravascular coagulation. Her blood started clotting in the body, maybe incompatible transfusion. Her was B positive and some A positive group given. Blood started clotting. Since the clotting started, migraine started, body pain started, nausea started. Patches appear because blood started clotting in the skin. And when she started coughing, in her lungs the blood was clotted. Now the surfactant, the mechanical the surfactant started coughing out. So see, these are some typical. Listen, in the real world, patient won't come to us and patient will say, I had a hemophilia B with this gene mutation, treat me. No one will say, right? Or I had an incompatible blood transfusion. I was B positive, but I got A positive. Then my surfactant leaked. That's why I got this symptom. Treat me. No patient will tell all this data. Right? Our textbook will tell the data and diagnosis. In real world, it's a clueless game. Keep in mind, okay? Actually, case studies are very interesting. Yes, Melissa, you want to add something here? Melissa, I'm giving you a challenge, Melissa. If a patient has a sickle cell anemia What type of symptoms might the patient might exhibit? Think now. Everyone you can collectively you can think. If a patient has sickle cell anemia, what are you expecting from him? What signs are most probable signs? If a patient has sickle cell anemia. Yes, Miss Arpita. Fatigue. Penicillin. More accent issue, I guess. Pain of skin. Or itching of the skin. Anyone? A typical sickle cell symptoms. Fatigue, one. Dizziness, other synonym for or nausea. Jaw, very good. Everyone appreciate this. Breda, very good, Breda, very good. Yeah, joint pain. Can you tell me why joint pain? Huh?
Low oxygen
Low
supply.
oxygen to the yeah, that is one reason. Another one was, very interestingly, joint bleeding will happen. The red blood cells will block the arteries. The sickle cells, they will block the arteries, leading to ischemia and joint pains. Okay, very, very problematic. I don't know whether you can understand this or not. Imagine the smallest capillary is present to the heart and the eyes. Smallest, narrowest blood, pipes. If this sickle cells blocking your eyes will start becoming reddening and you will start bleeding out of your eyes. And imagine the pain of the patient. Yes, sickle cell anemia is very challenging. By the way, I didn't discuss with you, these symptoms will be more seen in the night, not during day. You know that? Yeah. When you are sleeping, actually, even in sickle cell patient, RBC looks biconcave. Only in the absence of oxygen, it will change the shape to sickle. That is why sickle cell anemia is asymptomatic and misdiagnosed cases. Under normal morning conditions, if the RBC has sufficient oxygen, it will be in biconcave. During night, when your oxygen reduced, the RBC will change to sickle. Night sweatings. So there is another specialized test actually for sickle cell anemia. Very interesting test, where we will remove oxygen from we will keep a drop of blood on glass slide and we will add a reduction agent. Reducing that means we will add something that will remove oxygen. Then we will see after incubating for 5 minutes. Very interesting. One of my friend, I cannot say my friend, actually I am saying him from my childhood onwards, neighbor, his name was Karthik actually. He has thalassemia and he was exposed due to thalassemia. Every 3 days he needs to have blood transfusion. Such a painful, from his birth onwards he has this issue. He's a small kid when I'm saying, around 4-6 years old. He used to carry blood bag under his shirt. He has a separate, cloths. He used to play with, transfusion. Very painful. And he underwent this bone marrow transplantation, but we lost him. Very painful. Blood hematology, we think blood is simple thing, but blood connected to life. The last message still I have it. What's up? Next. Who discovered blood groups? Who discovered archetyping? Very good. If you are more, keen in observation, Alexander Weiner photo is somewhere available in one of the wall outside. Probably we can, but Carl Einstein we must be there. Yeah, very good. Kunsa would be the great initiative. Very good. Next. Who discovered the microscope? Right. Yes. Who discovered microscope? Robert Cook. actual credit goes to Robert Hooke, but it is Anton van Leeuwenhoek who used for medical application. Robert Hooke is a physicist. Okay, anyway, they are both contributes. Very good. Very good. Then, what is the unique characteristic feature of Romanowski stains? Ria's expression itself broken my heart. And she don't even know. I mean,
I didn't understand.
Romanowski stain.
Romanowski stain.
Yeah. What is Romanowski stain? Do you remember? Yes, Ria trying to pretend like she knows. Yes, Ria. Yeah. What is the Romanowski stain? Very painful. Anyway, check your pages, check your history, time travel. What an excuse. I was upset on that day, so kindly excuse me. What is Romanowski stain? Have you heard about this word by the way? Romanowski, you should. Very important. Now she got the answer, that's why she's telling she knows now. Yes, miss, what is your good name? Lawmet, yes, tell me Lawmet, like Cybernet. Yes. You take one then. Really others. That's close answer, but still. Romanowski stains are the stains we are widely using in hematology lab. Keep in mind first, whatever stains we are using in hematology lab, they are Romanowski stains. And the primary characteristic feature of Romanowski stains are, these are the dyes suspended in alcohol medium. Do you remember? Alcohol blended dyes are Romanowski stains. Romanowski stains base is always a alcohol. Okay. So all our hematology stains have OH, alcohol suspended stains. Okay. Very good. And now you know what is Romanowski stains, right? Alcohol suspended stains. Dyes are called Romanowski stains. Give me examples now. Examples of Romanowski stains. Leishman, Reich stain, methylene blue, Ginsa. Some we are using here. Ginsa stain. Any more else? What stain is not a Romanowski stain? Not a Romanowski stain. Non-Romanowski stain example. Very good. Very good. Ram stain. Very good. Any more examples? Non-Romanowski. HLE actually falls under this category, Romanowski, but histopathology stain. HLE is this side, Romanowski. Next, any others? Non-Romanowski, apart from Gram stain. Who said AFB now? Huh? Ria. That is correct answer, you should take credit. She is thinking that is wrong answer. Yeah, AFB. AFB is a non-Romanowski. Is there any other super smart student who can give third example of non-Romanowski? Huh? Can you justify? Do you know what is Kaiser stain by the way?
Yes, sir.
Then justify it.
Metachromatic
granules को देखने के लिए.
What a technical term. What is metachromatic means? I don't know this one.
Which granules जो बैक्टीरिया को मतलब एनर्जी प्रोड्यूस करते हैं उसमें फॉस्फेट.
Metachromatic इसका
सर जो कलर्स को इम्पार्ट करते हैं सर जो खुद में
कलर्स को इम्पार्ट another technical word.
इम्पार्ट कलर्स है.
Metachromatic. What is the meaning of meta? No idea. What is the full form meaning of meta? Something that is non-existing. Something that is beyond. Or meta means false simply. Okay. Facebook meta, false world, meta world, virtual reality, whatever. Meta means false. Chrome, false color. What they are trying to say in metachrome? See, these are the stains that won't stain the actual cell. Rather than they will stain the background. That's why they are called metachromatic. Capsulated bacteria, capsulated microbes can be detected by this metachromatic stain, so called. And that is this example stain name was nitrous stain, whatever. And these stains are classically called as negative stains. Negative stains. Okay, very good. Then, what cell nucleus will change day to day upon its age? Now, RBC has nucleus, Miss Arpita. Then why are you saying RBC? What cell nucleus will change depending on its age? Neutrophils. Everyone clap for this very side. Neutrophils. That is why neutrophil is also called as what? Pop something she is telling there. Yeah. Many morphology cell, polymorph cell. Because if the number of folds in the nucleus will be increased depending on the age of the neutrophil, polymorph cell. What is the least populated cell? Simon. Least populated cell in the body. कौन सा सेल सबसे कम होता है? Yeah. Yes, sir. I think this Pradeep was your best friend, right? He has inherited all his traits. Base of it actually. Very good. How will answer now? Heparin secreted by kaun sa cell? Hawa. Which cell will secrete heparin? Everyone clap for Hawa, right? Kidney shaped nucleus present in? Kidney or bean shaped nucleus present in? Monocyte. Everyone clap for Julieta. Very good. Okay. Then tomorrow can I conduct proper exam, theoretical exam to you? You should be proud now, you know everything. Alright, let me take your attendance now. Yes, Miss Ria.